Good morning. Welcome to Dear Pandemic's live Q&A. I'm Dr. Malia Jones. I'm the editor-in-chief at Dear Pandemic, and I'm here this morning with Dr. Lindsey Leininger, who is the nerdy-girl-in-chief at Dear Pandemic, and we're going to take your questions that come from our question box. So welcome. I'm going to start off, as always, as a thank you to our readers for all the terrific questions. We do read every one of them, and it's always really interesting to see what the themes are. We're starting to see a couple of strong themes, and we're going to talk about a couple of them today. So how are you, Lindsey?
I'm as well as one can be in the current milieu.
Yeah, it's been a heck of a week, hasn't it?
I'm a little underslept and a little overcaffeinated. I imagine I'm not alone.
Yeah, I think that's the state of the nation. You could just give that as the speech right now, I think, probably.
Totally. So while I'm thinking of this, and while I'm thinking about Malia's comment about the question box, I would just like to encourage folks to know that many of folks' questions probably have been answered by us at some point since March, since we've been at this. We have a website, dearpandemic.org. We've archived all 600 plus of our posts. And we've made it easily searchable. So we really encourage folks to use that as a resource. Personally, I find myself searching it all the time. Like, what did we say about that?
I know, it's like it's my number 2 website that I visit right now or something like that.
Yeah, no, I find it very helpful to have it in like a searchable format.
Yeah. And if you have a question, you should go over there and first search for your question, because we may have answered it already. And second, submit it to the question box. We don't take questions cold from the comments here on the live show. So you have to put it in the question box, and we will consider it for the next week.
And Malia, can I ask you to reinforce why we don't take things cold? I got a little bit of friendly pushback from someone in my personal circle about that this week.
Oh, really? Yeah, we don't take questions cold because we often like to look up the answers to make sure that we don't say something that's incorrect, right? We're scientists. We like to look it up before we start talking.
We do. We're like the teacher's pet homework doing types.
Yeah, that's we call ourselves those nerdy girls for a reason, right?
We need to study before we do this on Saturdays.
Yeah. In fact, just before I hit the go live button, Lindsey and I was telling Lindsey that I stayed up late last night trying to figure out how the news networks make their calls about election returns, and like really researching those models that they use to see if I could figure out what they are. So just as an example of how nerdy we are.
We are authentic to the brand.
Okay, so if you have a question, you put it in the question box. We do read every one of them, and we use them not only to pick questions for next week's live, but also to inform our content for the upcoming week. In fact, I think last week we mostly answered questions out of the question box. So go ahead and put them there and we will see them. And that's at dearpandemic.org. Okay, so we are going to start off with a lightning round. Normally, our shtick is that we want to help you understand the science and make your own informed decisions and figure things out for yourself. But we also are aware that sometimes that's irritating and you just want a simple yes or no. So we are going to do another lightning round. I'm going to ask Lindsey 10 questions, and she is allowed to give yes, no, or unknown answers to these questions. Are you ready, Lindsey?
I'm ready.
Okay, so first off, Stephanie from Illinois wants to know, oh my gosh, I said Illinois again.
You did.
What is up with that? It's the second time that's happened. I swear I know how to pronounce the name of that state. All right, Stephanie from Illinois is asking, I have been going to my elderly parents' house and talking to them through a closed glass window. We're about 2 feet apart, and we assume she means with the pane of glass in between, fully closed. I wear a mask since I'm outside, but they don't wear masks inside. Do we also need to be 6 feet apart?
Happily, no.
Yes, I agree. And I know we're only allowed yes, no answers, but a closed window would be an excellent barrier for any air exchange, right? So that's why no. All right, Anonymous wants to know, is a KN95 mask more effective than a cloth mask?
Yes.
Joe from Washington, D.C. has a related question. Do cloth masks reduce the spread of COVID-19?
Yes.
Yes. Jane from Austin, Texas. If I put my mask out in the sunlight, will it be disinfected?
No, the sunlight's not strong enough in terms of UV disinfectant. No.
Right. Molly from Madison, Wisconsin would like to know, if two households observe a very strict quarantine for 14 days, and that means only masked curbside grocery pickup and no other interactions with others, then is it safe for them to share indoor air at a holiday?
Yes.
Yes, that's the way to do it. Brianna, also from Wisconsin, would like to know, can a piece of clothing that has some virus on it release the virus so that it becomes airborne again and then be inhaled?
Okay, so we never say never because we're scientists, but it's hard to imagine that that's a problem.
Yeah, I agree with you.
I really doubt it. I mean, we are not trained to ever say no like that with certainty, but probably not.
Yeah, let's go with in all practical situations, no.
There we go. I like that.
But don't, I don't know, purposely aerosolize your clothing. I can't even imagine how that would work.
Right.
Okay.
No, please don't purposely aerosol your clothing.
How would you? I don't know. Okay. Gila from Rockland County, New York. I know someone who was COVID positive back in April and COVID positive again with symptoms both times now in October. Is it possible that SARS-CoV-2 behaves like shingles and will flare up whenever it wants and never actually go away?
We don't know right now.
That is a true unknown. Sharon, also from New York, is it true that the eyes are the main source of transmission?
No, it's not true.
Michelle from Pennsylvania, can you have COVID without ever having a fever?
Heck yes. And indeed, this is very common and more common in kids than in adults. Yes.
Yeah. Paulina from Mexico would like to know, is it true that it is safer to get the virus from a kid to a kid and from a kid to an adult than to get it from an adult? So basically, is the virus you get from a kid less severe?
Same virus. No.
Yeah, I agree with you. There's actually a related question from Melissa in Texas. Can children spread the virus to adults?
Yes.
Indeed. Okay, that was actually 11 questions, and we didn't say yes, no to all of them. So we did our best, though.
How did I do? I tried very hard to be brief. It's hard.
It is so hard. Which is the one you want to expand on a little bit?
I think the clothing one, because it has to do with risk reduction and a theme that Malia, you're really good at sort of keeping the thread going, that like nothing's risk-free, but we only have so much psychic capacity to manage risk. And so it's just important, probably for your well-being, to let some of those go, even though nothing's 100% safe.
Yeah. And I agree with you that it's important for your sanity. It's also, it's important to let some of the things go so that you can focus on the things that are really important.
That's
and,
right.
Early on, we didn't know if transmission was mostly happening through surface contact, or if there was a lot of virus that was getting stuck to our clothing or our shoes when we were out and about. But those things have become more known, right? That is not the main way that the virus is transmitted.
Great point.
So I think you can let those go and focus on the main ways, which is sharing air with other people.
So I get to ask you a question now, right?
Yep.
Okay. Kathy from Minneapolis. Thanks for writing in, Kathy. My sister-in-law recently had COVID. She thinks it's safe for her to visit us at Christmas because she's already had COVID. Is this accurate? Is it safe to be around someone who is no longer contagious?
This is a great question, Kathy. It's a really important question in terms of managing the pandemic, because what you're asking about is how strong is immunity after you've been infected with COVID and recovered, and also how long does it last? And so this is super important for figuring out all the questions around herd immunity and how many susceptible people are out there, and some questions around the vaccine. And it's also, of course, important for Kathy and her plans for Christmas time. So I'm going to start with saying I'm not an immunologist. I have a basic understanding of what immunity is that I'm going to share with you. And we can follow up with an actual immunologist for more details. So what happens when we are exposed to a new virus that we have never encountered before is that our immune system, cells in our immune system, recognize it as being something that's foreign to our body. They respond to it in a couple ways. One is by fighting, trying to kill it, get it out of our body. And then the other way is to figure out how to recognize it. And your immune system, after it figures out what the sort of signature, what this virus looks like, has a way of storing that information so that the next time we encounter that same virus again, the immune system is more prepared to recognize what it is and then respond to it, right? So that's a real high level of what we mean by immunity. Nobody has immunity to SARS-CoV-2 until they have had it, until they've been exposed to it. And the idea of developing a vaccine is that we could, theoretically, this is how vaccines are meant to work, we can introduce the virus to someone for the first time so that our immune system is prepared to respond to it when we encounter it the next time in the wild. It's also why this has become a pandemic. No one had pre-existing immunity to this virus, right? Because nobody had ever been exposed to it before. More or less last fall was the first time any human was exposed to it. So what do we know about how long that immunity lasts? So for some viruses, immunity lasts for life after you've been exposed to it. Measles is a great example. Once you've been exposed to measles, your immune system remembers that forever. Other viruses, your immune system kind of forgets. Immunity wanes, which means that it can no longer easily recognize that same virus again. And what we know from studying other coronaviruses, other related viruses, is that immunity does wane for most coronaviruses. Now, for this one in particular, we actually just don't know yet how long immunity lasts, or how strong it is in terms of durability. Like, so if you were to be exposed to it a second time, would you get just as sick, or maybe more sick, or not sick at all? So there are a lot of unknowns, is what I'm saying. The things that we do know is that after someone has had symptomatic or asymptomatic COVID-19, they do have antibodies that are specific to COVID-19, at least for a little while. You can detect those in their bloodstream. We don't know if those antibodies are enough to protect you from reinfection, and we don't know, although they probably do protect you somewhat, at least temporarily. Or else we would already be seeing tons of people reinfected. And we also don't know how long they last. Based on the 8 months or so of data so far, it does seem like most people do develop at least some immunity after they've been infected. I think in terms of having your sister-in-law over for Christmas time, there are just, I would advise against it, because there are a lot of unknowns about how protected she may be from developing SARS-CoV-2 again. So that was a super long answer. I could have summarized it briefly as we don't know.
I'm sorry. If we want to inject a touch of hope, it is like the area, I feel like, of.
Oh, yeah. Yeah. So it is so important to understand this, because it gets wrapped up in this issue of herd immunity. If people's immunity to COVID-19 lasts for a long time, if it's lifelong, or even if it's like 5 or 10 years, then all the people, and there are tons of people who are sick out there right now today, all those people will not be re-entering the pool of susceptibles, right? They'll be removed from the pool of susceptible people. And eventually, if there were enough disease, then there would be enough people with immunity to stop the pandemic, right? That would, to have that happen naturally would actually, it would be a true historic disaster. But that's the idea of a vaccination program, is that we take people out of the pool of susceptibles by vaccinating them. And then the disease has a hard time finding susceptible hosts. If immunity is shorter term, if it lasts, 9 months or a year, then we're going to be probably having the vaccine. We'll have to have it every year, most likely, if that ends up being the case. And the people who've had a natural infection will also be re-entering the susceptible pool, which make it really hard to achieve herd immunity. That's actually similar to what happens with influenza. And that's the reason we still have influenza outbreaks every year, even though we have a vaccine for influenza.
So Malia, I'm going to say something. You're humble, and so you would not say this, but I'm going to say this to brag on your behalf. I'm delighted that you gave such a long answer because you're a herd immunity expert.
Yeah, herd immunity is what I do. I started off saying immunology is not what I do. That's not what I do, but I do herd immunity.
Exactly. So thank you for sharing your knowledge with us.
Yeah. So I have one final note here on this question. There was a little bit of mixed up language in the question, and I just want to note what it means to be no longer contagious, because that's something different. What it means to be no longer contagious is that after you are acutely infected, like you have viral material replicating in your body and it's coming out of your nose and potentially infecting other people. That's different from what happens in your immune system after you've recovered from SARS-CoV-2 that might protect you from being reinfected, right? So the CDC says that after you've been acutely infected, you are no longer contagious. There are 3 conditions that have to be met. One is that it's been 10 days since your symptoms started. Also, it's been 24 hours since you had any fever, and your other symptoms are improving. So at that time, there's no longer active infectious viral material coming out of your body that could get someone else sick. But you're probably building antibodies, and we don't know a lot about those antibodies right now. Okay, so are you ready for your question?
I'm ready for my question. And I want to inject an apology for the distraction of me getting up and moving around. The sun moved a little bit, so I noticed there was some glare. And
I talked for so long that
no. Certainly not my intention. Apologies for the distraction. I was listening the whole time.
Okay, so here's your question, Lindsey. Julian from Boston, Massachusetts would like to know, Massachusetts has just instituted a 9:30 p.m. curfew. What is the rationale for this restriction? And we've got a note here. This is also happening in other communities, including in Dallas, Texas. So why would a curfew help curb the spread of COVID-19?
Thanks for this question, Julian. Just down the road in Boston, yay, New England. Also appreciate that question is coming from Dallas, my hometown. So shout out to places that I know and love. So let's tackle this with the what, the why, and the will it work. What curfew means is vast restrictions in movement outside of your house between late evening and early morning. Think 9 p.m. or 10 p.m. to 5 a.m. It's kind of a typical setting. So that's the what. It's not zero movement. Often people are allowed to, for example, go to work or do something that's caregiving related, but it's a vast restriction. So the why is what's interesting, and I think is perhaps a touch under contextualized right now in the reporting on it. So I'm really grateful for this question so we have a chance to talk about it. So on the surface, the why is much like when I was a teenager and my parents and others, that trope, nothing good happens after midnight. So that's a big piece of it. And specifically to this pandemic, it regards bars and alcohol, and that people get some inhibition sometimes if they're out late at night in places that are risky with respect to viral transmission and where there's alcohol mixed in. So that's part of the why. But I think the more important piece of the why for our consideration is what states and counties are trying to do right now is build in various layers of policies right now to prevent going back into a full, more restrictive, safer at home type situation like we were in back in April. So these curfews are not taking place in a policy vacuum. They're one of many layers of policies that governors are sort of desperately grabbing onto right now in the hopes to stave off a safer at home order. So just like we talk about layers of protective behaviors for people being like Swiss cheese, I wear my mask, I stay outside, and hopefully the holes in any given protective behavior, collectively they add up and you're still protected. Governors and local officials are having their own Swiss cheese making right now. So you can think of mask ordinances, you can think of curfews. All of these are a suite of policies that governors are trying to implement in the hopes that they will work. Okay, so will they work? Honestly, we don't know. The science cannot tell us this. So when we don't have evidence, we have to lean on expertise. It's all we've got. Experts don't seem to think that curfews, especially in isolation, will do much to stop the spread of transmission. I've dropped a link to a news article that actually has a really nice characterization of some leading epidemiologists' take on this. But I do think the hope is that collectively, the Swiss cheese can help us avoid a further, I don't want to use the word lockdown because that has such a hand grenade of an implication, but more restrictive, safer at home measures. So
Right.
here's hoping. And I will add a note. This is my nerdy girl note. I grew up intellectually as using data to tease out the true impact of one isolated policy measure, like imposing a curfew and what its impact was on an outcome. That is hard, careful work, even in the best of times. This is not the best of times. We are not likely to have evidence that's going to make a convincing slam dunk, yes or no, this does or doesn't work.
Yeah, and I'll just pick up this thread again that even if we were to be able to get I mean, you couldn't do that study now, right? Because
No,
you need the data from what happened after the fact in order to answer the question.
Well, what you would need, Malia, so we have Boston. I'm going to take Julian as my example here. So you have Julian in Boston. So what you would actually, Boston, which is imposing a curfew, you would need fake Boston that looks exactly like Boston along all characteristics that we can see and all of those that we don't see culturally, how they're doing with the virus, et cetera. And you would need fake Boston to do everything like real Boston, except not turn on a curfew. That's the type of study that can tell you whether or not curfews work. That's not the kind of study we do in a pandemic when it comes to policies. It's the kind of studies that we do sometimes for randomized controlled trials, but we just can't do that. We don't have that. We don't have the comparison group, clean comparison group design.
Yeah. I wonder if I'll just pose this follow-up question to you. We saw over the summer here in Madison, Wisconsin, where our Dane County Public Health Department has been sharing great summary level information about where we're seeing a lot of virus transmission happening. And we, in the summer and in, I'd say, the first half of September, we were seeing transmission in bar settings for Absolutely. Sure, especially, the campus bars that young people go to. So I wonder, do you think that's what's informed this as a policy attempt?
Oh, absolutely. If we think about bars and indoor dining at restaurants, they are definitely propagating the pandemic. I wish I could state that in a kinder way, but I can't. It's just the truth. Yeah. Now, will a curfew, I mean, that is not the same thing as imposing a curfew is going to stop the spread of the pandemic. So there is a leap of faith there between what we've seen in bars and restaurants and the assertion that a curfew is going to actually work to stop the spread. But, alas, that's what all of our policymakers, all they've got to go on right now.
Yeah. Indeed.
And Julian, I'm going to end with a thank you. I am the resident nerdy girl, policy wonk. So I was excited to have an opportunity to dig into my policy wonk background, thinking through this answer. Malia, you get the last question.
All right.
Val from New Jersey. There's a lot of talk about case counts going up, but the death rate going down. Are we expecting that the young people who are catching it right now will eventually transmit it to the more vulnerable populations, and then the death rate will go back up? Or is the death rate maybe going to stay low due to better treatment options?
Yeah, Val, thanks for this great question. I had fun thinking about this one too, because in addition to herd immunity, the angle that I come to herd immunity from is demography, and this is really a demography question. So there are two concurrent trends happening, and they're happening in tension with one another. They're changing things in different directions. So this is really hard to pin down, but you've hit it right on the nose for both of them. So the first question is the age of people who are getting infected. We have gotten somewhat better at protecting the people who are the very most vulnerable of all, which are people who are over age 80 and living in nursing homes. Early on in the pandemic, we saw a lot of devastating outbreaks happening in nursing homes, and the death toll in those places was really staggering. And we've gotten a little bit better at protecting nursing home environments, at least at this point. And so that has reduced the death rate a little bit all by itself. And then in addition, we do see that cases, especially at the start of this, right now, we're really seeing something that looks like exponential growth in many parts of the United States. And early on, when that curve was just starting to bend up, we were seeing cases concentrated in younger people. And that was also the case over the summer. And as we know, younger people are much less likely to die of COVID-19 when they get it. And so that kept the death rates much lower than what we saw early on in the pandemic. Now, there is some really excellent evidence that the September wave that happened among 20-somethings is now well established in older groups of people. You can see this really clearly if you look at the Wisconsin state data in particular. In the Midwest and college towns around the country, this delay of, between younger people getting it and then it slowly kind of percolating out into the community more broadly is really striking. And so the age of people who are being diagnosed this week is considerably older than it was, say, the first week of September. And I'm really worried about everybody getting together at Thanksgiving, because that's another great opportunity for direct contact between younger groups who are low risk and, grandparent age groups who are much higher risk of death. So, I think we are in a moment where we need to be really careful to protect older people who are at higher risk of death. And we do expect deaths to climb back up again based on the age of people who've been infected in the last few weeks. Another element to this age question is something demographers call the age structure of a population. And that just means what's the relative number of older people relative to younger people. And right now we're seeing huge numbers of cases in places that have more older people, especially rural places. So my expectation, and I think I'm not going out on a limb to say we're going to see the death rate go up in the next few weeks here. That said, I can end on a happier note, which is to say that the other aspect of this is that we have seen improvements in treatments as well. So treatment options have increased, and the treatments are doing a better job at keeping people alive, even at the same age. So the death rate for people who are in the hospital is going down, even when you compare, same age people from now versus back in say April and May. So we still don't have a magic cure, but there are more treatment options out there, and they're working better than they were early on. And I think we're going to continue to see innovations in treatment and also incremental improvement in treatment as time goes on here.
Malia, can I add a note of refinement to that?
Yeah.
So we can think of treatment as two ways. And I think often in kind of the general zeitgeist, treatment are drugs and pills and things like steroids. But what gives me hope and has always given me hope through this pandemic is innovations at the grassroots. And I want to amplify the innovations at the grassroots of the healthcare front lines. Because by treatment, we don't just mean remdesivir or dexamethasone. By treatment, we mean nurses figuring out to put patients prone, meaning on their stomach. We mean other clinicians and physicians and all of them on the front lines figuring out that actually you need to wait as long as you can to put people on a ventilator, right? So treatments aren't just like pills and shots, they're people. It's all those amazing people on the front lines treating these patients who have improved the clinical trial protocols. And
yeah, another aspect of it is figuring out who needs to be in the hospital and who needs to be on a ventilator, right? Like the screening procedures for who's really at high risk and who could be managed at home. Or as you said, the timing of when to start a treatment, when to admit to the hospital and what the, and that's just experience with the course of the disease. And so, yes, we are seeing clinical improvements that include both drugs and other kinds of treatments as time goes on. And we'll continue to see that, you know, we will continue to see improvements in treatment. So that'll reduce the death rate. But I do think we're in for a pretty rough ride in the next few weeks here.
And we'll be here to, you know, with our community.
Yeah. We had a terrific post yesterday, actually, about this moment and what has happened over the last week in the United States. While we were all paying attention to election news, pandemic was, of course, still happening. And we really did, it seems like, go from, you know, when you see exponential growth, exponential curves look like this. And this part of an exponential curve really just doesn't feel that extreme, right? That early part. But then there's this tipping point. And I think we came around that bend this week, and we are going to see, you know, this week we had several days with over 100,000 cases per day diagnosed, and of course that will continue to go up very quickly in the absence of any kind of intervention. So it's a very risky moment, and I hope everybody can dig deep. I know we all have pandemic fatigue, and we're really sick of this, but this is the moment to double down on all of our protections.
And we really are here to help people stay safe and stay sane. It's our mission. It's our commitment to the community.
Yes. So that is all we have time for today. Thanks for hanging out with us. And we will be back next week for more Q&A. If you have a question, you should put it in our question box. It's at our website, www.dearpandemic.org. We don't take questions out of the comments. I saw several people who asked questions in the comments. So we need you to go to our website and put those in the question box so we can answer them next week. We have to look them up before we answer.
We're nerds.
Because we're nerds. Okay, stay safe and stay sane, everybody. Thanks for joining us.